Good morning and welcome to this week's morning meeting with Groundwork Ohio. We're really excited to welcome our friend Will Petrik from Rise Together, and I'll kick it over to him in a couple minutes. But as always, since it is still state budget season, we wanted to just start with a brief update on where things are at in the legislature right now. So for those of you who've been doing advocacy with us, you know it's very busy in the Senate this week. So tomorrow at 4 p.m. is the Senate amendment deadline for the Ohio Senate. So our team has been meeting with members of Senate Finance Committee and leadership on both sides of the aisle to really push for restoration of the governor's investments in childcare access, as well as maternal health supports for Help Me Grow, infant vitality, making sure that doulas can be reimbursed in all 88 counties, and that we preserve continuous coverage of Medicaid for children from birth to age 3, as is an existing law. The other big thing, which we'll chat more deeply about today, is economic stability and the need for supporting working families by making sure that they have access to tools like the child tax credit. So Caitlin on our team was at the State House until what, 8:39 last night, Caitlin testifying. You know, no big deal, just spending her whole day in that committee hearing room. And a couple days before that, Troy did the same in Senate Health, covering all of the DCY programming that we support. So we've definitely been pounding the pavement. If you haven't yet put out our Senate action alert, I'll throw that in the chat. That would be really great to do today or tomorrow while they are huddling and making their amendment priority lists that each senator will present to the Senate President's office. So we'll throw that in the chat. And if you would like to make a call, if you want to chat about any of these specific amendments and try to call your legislative office, if you want to talk through strategy, just shoot me an email or call me and I'm happy to chat through. The more voices, the better speaking to these same amendments. And we've really appreciated all the coordination we've had with folks. Next steps, we anticipate the substitute bill being introduced in the Senate on Wednesday, June 4th. So that is right around the corner. And then it'll be a quick turnaround for their omnibus amendments the following week. So we'll continue to kind of send out these alerts, mention them on the morning meeting, and put them in our newsletter. So without further ado, if you've got questions about budget cycle, feel free to throw them in the chat. I'm going to turn things over to our friend Will. And if you have questions for him throughout, please go ahead. Thank you, Sarah. And put those in the chat too. We'll reserve a few minutes at the end so folks can come on camera and off mute and interact more organically if they like. Will has asked me not to read his full bio, but I will share that he is a very well-respected policy mind around economic stability and restoring and preserving dignity for families and making sure that they have everything that they need to thrive. And he is currently the Director of Policy and Advocacy at Rise Together here in Franklin County. He's going to cover a couple different things today. Advocacy to support tax relief for families through the refundable child tax credit, which we just touched on briefly. Advocacy to protect healthcare coverage. Will was really integral in expanding Medicaid here in Ohio. So I'm really excited to hear his insights on kind of where we're at in this Medicaid defense campaign that we're all chipping in on. And then trusting moms with the resources that they need through the Ohio Mothers Trust Program, which I'm very excited to learn more about today. So without further ado, I'll kick it over to Will. He's got some slides. We'll take a moment to transition and everybody can have a sip of their coffee and get ready to learn. Thanks, Will.
Yeah, thank you, Brittany. And so I just shared my slides.
They
Hi,
look great.
everyone. Again, my name is Will Petrik. And yeah, first, just want to say thank you all for being here, for all the work that you do, and just big thanks to Groundwork Ohio, just for all that you do to support kids and families, and specifically kids in the first 5 years of their development. So I am hoping to, obviously I'm going to be kind of sharing a lot about some of our work. So this is kind of my agenda. First, just want to, talk a little bit about Rise Together Innovation Institute, the challenge of poverty and economic insecurity, and then, what are some immediate policy threats and opportunities in this state budget, but then talk a little bit about some of the pilot programs that we're partnering on locally here in Franklin County to support the economic security of residents. So I do want to invite everyone, if you haven't, to introduce yourself in the chat. Feel free to include your name, your organization, the city that you're from, and maybe one of your core values. So for me, again, I'm here in Columbus, Ohio, and one of my core values is dignity, and dignity for all people. So, at Rise Together, our vision is Franklin County where every person has the resources and opportunities they need to thrive. And, we were founded in 2020 as a public-private partnership, really to innovate and implement and incubate innovative ideas to support residents find their path toward economic security and stability. Our mission is to harness the collective power of people and systems to disrupt poverty and structural racism and achieve equity for all residents in Franklin County. So again, I kind of first want to talk about like what is the challenge that we're trying to solve for. Ultimately, again, the issue of poverty and economic insecurity is something that so many people experience. So nearly 4 in 10 households in Franklin County struggle to afford, basic necessities like food, housing, healthcare, and childcare. This 39% is basically the number of households at or below the federal poverty level, and also the number of households at or below the ALICE threshold. And so, yeah, that's a huge number of households who are really struggling. The main drivers of this we think are also important as we think about like what are the solutions, what are policy solutions or programmatic solutions. So, increased costs, low wage jobs, and the fact that, throughout history, people in power have made choices to exclude people from resources and opportunities. We can see, even just today with the debate in Washington about potentially taking healthcare and food assistance away from some of the poorest people, at the same time, potentially giving tax breaks to millionaires and billionaires. Like that is a policy choice that people are making that, really determine the future of our communities and whether or not people can have, health and economic stability. So just a little data on each of those points. So this is kind of the slide that's, the rent is too damn high. Basically this shows, and excuse my language, just over the last several years, from 2017 to 2024, the cost of rent for a two-bedroom apartment has increased 47%. So $886 a month on average to over $1,300 a month in 2024. Median home prices have also increased dramatically, 54%. We've also seen, I know many folks on this call are advocates for affordable childcare and accessible childcare. That's another thing where we've seen increased costs in childcare, increased costs at the grocery store, even just getting a 30-year fixed rate mortgage. It was 3% in 2021 and 6.8% in 2024. This is the piece about, jobs and too many low wage jobs, not enough family sustaining jobs. So this slide really highlights, 7 of the 10 most common jobs in the Columbus metro area don't pay enough for a renter to afford a two-bedroom apartment. So, this also, really shows that basically these jobs, so the jobs that are highlighted in orange are all the jobs that, that average median hourly wage isn't enough to afford, the two-bedroom apartment kind of median cost. And the jobs in those categories, 7 of those jobs, they employ roughly 180,000 residents in Franklin County alone. And so, again, these jobs include fast food, retail, home health aides, and cashiers. They employ a lot of people. And again, people have jobs, people are working. They just, the wages aren't high enough to actually meet all the basic necessities. So this next slide is a map of redlining in Columbus. It's a map from 1936. And the point here, I talked about one of the drivers of economic insecurity and poverty as being a policy choice. This is one example of a policy choice. So these redlined neighborhoods basically didn't have, equal access to housing opportunities and to mortgages. And so, we know a lot of these impacts disproportionately impact Black kids and families. We saw during the pandemic, Black families were 3 times as likely as white families to experience food insecurity. And, that's a legacy of different policy choices. So redlining is just one example. The institution of slavery, Jim Crow, the exclusion of agricultural and domestic workers from Social Security and unemployment compensation. There have been several laws that have been passed that have included some people in resources and opportunities and systematically excluded other people. So, these redline, the legacy today, when you look at these same census tracts, these are the census tracts with the highest infant mortality rates, the highest poverty rates, the lowest median income. So again, the policy choices that have been made throughout history have a real impact today on people's lives. And that being said, again, with poverty being a policy choice, we know we can also choose economic security, economic stability. We can make the choice of dignity. So I think the other thing that we think is really important is not just highlighting, how many people are struggling with poverty and economic insecurity and the drivers, but what is the cost? What is the impact? And I know so many folks on this call, recognize, the cost of not being, not going to school ready to learn and grow in kindergarten, and how many kids are just already behind when they start in kindergarten. We know kids who grow up in households that have economic insecurity, poverty or deep poverty compared to their peers in more stable and secure income families. The outcomes are worse, right? Kids are more likely to do worse in school, have mental and physical health problems, more likely to get involved in the child welfare and criminal legal system. And so yeah, there's a real cost. We also know the economic insecurity and stress impacts the health of moms and their babies. And so, our partner Scioto Analysis estimated a cost, an economic cost, and it was $5.7 billion annually just in Franklin County in lost earnings, in incarceration, healthcare, child welfare, other social service expenses. And again, kind of the big message for us is these are structural issues, and we need to make structural changes, and it doesn't have to be this way. So, one of the big opportunities in this budget really is an opportunity to change the tax code to provide a little bit of relief for working families. So, in the governor's proposed budget, he proposed a refundable child tax credit of $1,000 per child age 0 to 6. And, this is for families with income greater than $2,500, and also had an income cap. So, households with a two, people who are married filing jointly, income at or below 94,000 annually. And we looked at what would this actually mean for people? What would the impact be? And ultimately, if you think about a single parent with 2 kids making $45,000 annually, ultimately they get $2,000 at the end of the, or excuse me, not at the end of the year, when they file their state income taxes, they'd be eligible for $1,000 for each of those kids. And so that $2,000, in additional money in their pocket, that can help pay for diapers. It can help pay for gas or car repairs or, pay off debt. We, asked the Institute on Taxation and Economic Policy to do some analysis. And again, because our focus is Central Ohio and Franklin County, we were looking at what's the impact in Franklin County. They estimated 64,500 kids and their families would benefit from this. An estimated $36 million would flow directly into the local economy, and an average annual tax cut of close to $1,000, $940 for 38,500 households with kids. So as we've been basically trying to make the case to lawmakers. I was testifying last night with Caitlin pretty late. But we try to talk about, this is something that we've tried before. So, during the pandemic, federal lawmakers basically, expanded the federal child tax credit. And it provided 1.2 million families in Ohio with some relief from stress. It provided $435 a month for 6 months, and the impact was immediate. So again, families have more money to just pay for basic necessities. People reported a little bit less stress, more peace of mind, less food insecurity, and child poverty fell to a record low of 5.2% in 2021. And, according to a survey by Brookings Institute, 70% of parents said the payments help them better manage rising prices. These two quotes are from people in Ohio, and basically, they were sharing, what has this expanded child tax credit meant to you and your family? So Jason shared, it helps us to survive, to plan, and have hope for an improved quality of life in the future. Sophia Whitehouse, who has two kids, or at the time had two kids under age 5, she said the child tax credit has been a tremendous help for paying for preschool and childcare for my two kids under 5. So I do want to acknowledge, the federal child tax credit was a lot more money per child. So it was $3,000 for kids age 6 to 17, and $3,600 for kids age 0 to 5. And so again, the governor's proposed tax credit is up to $1,000 per child, age 0 to 6. So this slide, again, big thanks to Groundwork Ohio. There was a poll from Public Opinion Strategies that was commissioned by Groundwork Ohio that, again, just really shows what people are facing across Ohio. 94% of parents said getting inflation and the cost of living under control was important to them. And they also found that 87% of likely voters support a child tax credit to provide tax relief for working families. So, again, Governor DeWine's budget included this tax relief and this refundable child tax credit. The House passed budget eliminated this provision. And so we're asking state senators to provide tax relief for working families by restoring Governor DeWine's refundable child tax credit. I also want to invite you all on this call, and you may have already gotten an invite from Groundwork Ohio. We are bringing people across the state together for a rally for working families. We're going to be highlighting both the need for tax relief, but also the need for more affordable childcare and, all the things that families need to live with stability and to thrive. And so there's a QR code here. I've got too many things on my screen. I was going to try to share the link in the chat. I bet someone from Groundwork Ohio will be
We
able to
got
do
you.
that. All right. But yeah, we'd love to see you there. We know this is going to be, we're going to need to have lots of voices from all across the state, urging both the Senate, but also as the budget moves to conference committee and kind of the final aspects of that process. We really want to, highlight all the different solutions to support working families. So we'd love to have you there. We'd love for you to be a part of it. So I'm running low on time, so I need to kind of run through some of this stuff. So one other thing, so again, broadly, our mission is really about all folks dealing with economic insecurity. And so in this proposed budget, there's a proposal that could take healthcare coverage away from 770,000 people in Ohio, and more than 115,000 adults in Franklin County are at risk of being pushed off of Medicaid. If this were to happen, people wouldn't be able to get the health care they need. More people would be pushed into medical debt and emergency rooms. It would also mean thousands of job losses across the state and more people struggling with financial instability and stress and disease. Uh, this, some of you probably have heard about the Medicaid trigger language. Basically, it would automatically end Medicaid coverage for people in the Medicaid expansion population, known as Group 8, if the federal government reduces its match rate even slightly. So right now, the federal government covers 90% of the Medicaid expansion program. So again, the federal government is paying $9 for every dollar of state investment. And so if that drops to below 90%, basically the trigger language would abruptly, roll back the entire Medicaid expansion program, pushing hundreds of thousands of people uh, off of their coverage. So again, just a little more about the impact, potential impact of if that were to be triggered. Ohio could lose $61 billion in federal payments for healthcare over the next 10 years. Again, Scioto analysis estimated Franklin County could lose close to $1 billion annually, 926 million in federal funding. And that alone, that funding cut would put up to 8,500 local jobs at risk, particularly in the healthcare and social service sectors. So we are also encouraging, people all across the state to take action to, email state senators and encourage them to protect healthcare coverage for people across the state. So I do include a QR code here and hope that you all scan the QR code and take action. It only takes a minute. We basically have like a form letter that you can click. Again, since our focus at Rise Together is people in Franklin County, we do highlight the threat of how many people could lose healthcare coverage in Franklin County. But on the action page, we also include a link to the Health Policy Institute, basically a table that shows how many people in all 88 counties across the state, could lose access to healthcare coverage. And so you can, edit the email and edit the communication and send it to your state senator and to key Senate leaders who are, really determining the future on this. The other thing, if people are interested, there's an Ohio Medicaid Matters coalition. We've recently joined, and so there's a whole coalition effort around really protecting healthcare coverage for people on the Medicaid expansion population, and really the main focus specifically is shifting the language from shall to may. So that's kind of the policy wonky, but again, the outcomes of this is really what is a real threat again to people. So if you're interested, you can learn more at ohiomedicaidmatters.org. Um, and I'm going to try to run through this in like 2 or 3 minutes so we have a little time for questions. So Also wanted to share just some of the local partnerships that we're a part of. Um, so Ohio Mothers Trust launched in December of last year, and we're in partnership with Motherful and Up Together. And basically, we're providing 32 single moms with $500 a month for a year. And the whole pilot is based on, different guaranteed income pilots that have been emerging across the country that, have proven to, again, provide a little bit of peace of mind to help people pay for basic necessities and provide for some more financial stability. So again, that just launched in December. We're partnering with The Ohio State University to look at the impact of this and really think it's an innovative strategy to support moms and families and provide them with a little bit more stability. One other project that we're a part of, it's called the Community Information Exchange. Uh, and, you know, a big part of this, we've identified, and actually the Middle Ohio Food Collective did some initial research just asking residents in the county about getting connected to resources and services, and basically found, while we have a lot of resources, it's a difficult maze to just navigate getting connected, whether that be to childcare or food assistance or healthcare. So basically we found from residents, it's really difficult to get connected to the resources they need. And we also heard from caseworkers again that they're spending a lot of time on paperwork, on administrative stuff, and could want to spend more time doing the delivery of services. And so the CIE ultimately, well, excuse me, here's the journey today that again is based on research and feedback from residents who have tried to participate in services, whether those be public services like SNAP and Medicaid, or different nonprofit services or local childcare services. And so it's again a maze sometimes to get connected to all the resources that they need. And ultimately, the goal of the CIE is to make it easier for residents to get the resources and services that they need, to make it also easier for those frontline caseworkers to do more of the service providing and less of all the administrative and paperwork and all of those different challenges, and really change how we deliver services in Franklin County. So also wanted to share that exciting initiative. It's both, going to be a technology solution, but also really it is kind of a how do we change how we do business, across the health and human service ecosystem in Franklin County. So with that, the one final thing I wanted to just invite people to is our annual summit. So this is for anyone who's interested in, this work of trying to disrupt poverty and structural racism and just advance economic security for all people. So this is free and open to the public. Really excited about Heather McGee, our keynote speaker. And you can, again, if you're interested, scan the QR code to RSVP. Um, all right. So with that, I didn't leave much time for
That's
questions,
all
but
right.
yeah.
No, this is so great. And I made a list of all of the links that we're going to make sure we include because folks were in the chat making sure they want to get the slides and all the QR codes. So thank you, Will. And thank you for putting like a tangible point on what the CTC could mean for families and showing the economic impact of what the threat to Medicaid is to the state. I just, your presentation is so timely and spot on to everything that we're all talking about each day. So thank you so much for putting this together. We are close on time, but I'm going to invite if somebody has a question, pop off mute. Let's just make it informal and pop off mute and go ahead and ask. I know we've got some chat folks. Everyone's very grateful for the info. I'll pause.
So one question I have for everyone is, we've been asking this question of just what does it mean to thrive? So if people want to share 2 or 3 words in the chat of just what does it mean to you to thrive? Um, just building meaning around that North Star.
I love that.
Hmm.
So, what does it mean to thrive in the chat? And for those who, Rachel being out of survival mode. Oh, getting some pins there. Um, some- Thank you, folks. Well, I think as far as action items, well, the rally is a big one. Are there, and then we've got the healthcare sign-on letter. Are there other actions that you would like folks to take today as they're planning their Thursday? Oh, perfect. You've got the letter in the chat.
Yeah, I just put the letter in the chat and then also the link to RSVP to the Pivot Summit. I know the RSVP for the rally has already been shared, but it's probably way up there. So I'm gonna just share that again. Um, but yeah, thank you so much for just having me, and thanks everyone on this call for being engaged and being in this work. It's can sometimes be very challenging, but it takes people being in it for the long haul. So appreciate y'all.
Well, you're definitely one of those people, Will, and we're grateful for your partnership. And we'll get all this out in a follow-up email too. So everybody do your action items for the day and we'll keep working together and supporting one another. Thank you so much, Will. I look forward to chatting with you soon.
Thank you.